Infection rates are also climbing around the world. According to the World Health Organization, the number of cases worldwide has roughly doubled in just the last 6 weeks. The United States, Brazil, and India have topped the world's caseloads, but numbers are also rising in places that had previously appeared to have the virus under control, such as Australia, Japan, and Spain. And since the start of the pandemic, more than 16 million cases have been reported to the WHO, and more than 640,000 people have died. Crystal Goomansingh has more on the global picture, including the man known as Asia's sickest patient.
He is rail thin, struggles to breathe and walk. Back in March, while working in Vietnam as a pilot, Stephen Cameron was diagnosed with COVID-19.
And I was under for 10 weeks in life support. It's no laughing matter. It's a very serious thing, and I think people can't be blasé about this.
But it appears people are being careless. Vietnam is forcing 80,000 people to leave the popular resort city of Da Nang because of new cases. Infections are rising rapidly around the world. Australia recorded its highest daily count Monday, despite the fact that nearly 5 million people in the state of Victoria are on lockdown.
We have too many people who have symptoms and they are going to work. And what that means, even with mask wearing, that is an unacceptable risk in terms of transmitting this virus.
Spain is also dealing with a surge in cases, as is Japan, Ukraine, even Belgium. In Brussels, the Prime Minister says the reproduction rate of the virus, the number of people one infected person can spread it to, has been above 1 for several days, leading to a surge in cases. As a result, for the next month, people can only interact with 5 others.
What is clear that pressure on the virus successfully pushes the numbers down, release pressure on the virus, and the numbers can creep back up.
Since January, the World Health Organization has been pleading with people to take the virus seriously, noting that travel bans can't be kept up indefinitely and multiple measures are needed to stop transmission.
So whether we're dealing with second peaks within the first wave or second waves, in some senses is not the right question to ask. The question to ask is, how much pressure do you have on the virus?
I mean, I'm a living example of what this virus can do and how it is serious.
The 42-year-old is hoping by early next year he'll be well enough to fly again. Crystal Goomansingh, Global News, London.
President Donald Trump's national security advisor has just tested positive for COVID-19, making him the highest-ranking official in the Trump administration to contract the virus. Robert O'Brien is now in self-isolation and said to be experiencing mild symptoms. O'Brien appeared publicly with Trump in Florida back on July 10th, but it's unclear if they've met face-to-face since then. One of O'Brien's daughters has also tested positive.